Dr. Hawary, is an Invisalign treatment or a basic orthodontic treatment, but especially Invisalign in this case, is this a good option for some adults who have one or two or three slightly crooked teeth in front where they could be and have been told to put a veneer on it and, shave the teeth, put a veneer on it, and it's of course a very good option to have good looking teeth with no doubt. But some people, well, they don't want it and maybe even want a slightly less expensive option, and would an Invisalign be a good thing for them?
Absolutely. Invisalign is a great option. Invisalign is a great option in dentistry today. However, Invisalign, in my opinion, I do both and I do them a lot. I do Invisalign a lot. I do a lot of cosmetic enhancement with veneers as well. In my opinion, there are elements that should make one better than the other depending on the case. So if the teeth look perfectly beautiful, they are white, healthy, perfect looking teeth, then definitely there's no doubt that nature provides the most beautiful looking teeth. And I would definitely tend to align the teeth with Invisalign versus shaving off the teeth, even though my veneers would look great, but conserving the natural dentition is the best way. On the other hand, if someone has some crooked front teeth, but the teeth are very ugly, they are very dark, they are worn down, they are breaking with a lot of decay and a lot of fillings, all discolored composites, bondings, and etc., then definitely Invisalign is not the only needed treatment for that patient to get him to a beautiful smile that he's very confident with. So aligning the teeth can be a step towards, making some either bonding or veneers afterwards. So the look of teeth, in my opinion, gave me an idea whether I would be more biased towards veneers or Invisalign for that particular patient.
Or a combination.
Or combination. In any time we can, if the teeth are very crooked, and we can align them first with Invisalign. If they don't look good at all, and we're still going to do veneers, and we do align them, then do veneers, that's the best of the two worlds, because we gain the conservative way of making the teeth straight, so we're not really filing a lot to make them look straight, and at the same time, we gained the beauty of the veneers that would give a perfect looking, a Hollywood smile if a patient wants that, without cutting too much of the tooth. So yes, there are a lot of cases that we combine Invisalign with veneers as well.
Well, all right. So, so basically an adult who has a little bit of crooked teeth, but otherwise quite beautiful teeth, he might consider a little bit an Invisalign, and it may sometimes not even take a year or two. It may sometimes only take a few months to straighten them out if they're not too crooked, right?
Yes, a lot of cases. I don't see a lot of cases except very complicated cases that goes to 2 years. Most of the cases a year or less to get these some crookedness or misalignments to be straightened out. So it's a very convenient, very fast way without cutting too much or even spending too much like veneers.
Wonderful. A nice, beautiful way to get that $1 million smile, right? That's kind of like, after all, I mean, in the end, maybe a little bit too many pounds on the belly is of course not what we want, but the truth is, the smile being a little bit out of shape is a lot more noticeable, is a lot more devastating to people than a pound or two more on the belly.
Absolutely, I agree. Cannot agree more.
Thank you very much,